Now, using thrombolytics, there's some absolute relative type of contraindications, but keep in mind, before we move on here, if your patient is already in a state of bleeding, why would you want to use a thrombolytic? That's just going to exacerbate the issue. It might actually kill your patient. So, who are my patients? Hemorrhagic strokes, non-hemorrhagic stroke past 3 months, intracranial neoplasia, active internal bleeding, aortic dissection, closed head or facial trauma, once again for 3 months. Now take a look at some of these. If the patient is already at risk for severe bleeding, by adding a thrombolytic, these are absolute contraindications for then using a thrombolytic. Now, this is absolutely used for any license exam. Now, in clinical practice, you might always find that attending who might be extremely confident in his or her ability to still give a thrombolytic in such situations, but that is not being asked here, nor is it going to be asked on your boards. Relative. Severe hypertension, proliferative diabetic retinopathy, what does that mean to you? You're thinking about the eye, and when it undergoes proliferation, you want to be careful, though, because what might you do? By thrombolytic, you might then cause bleeding taking place. Known bleeding diastases, for example, von Willebrand disease, prolonged CPR, allergic reactions, pregnancy, blood pressure, ulcers. Be careful there, please. Very careful. Actually, for example, when you use a thrombolytic at some point with that ulcer, there might be so much bleeding that you might actually bring about perforation. So please be careful when using such drugs. Contraindications for thrombolytics, absolute versus relative.